What's up, guys? Dr. Seth here to solve more powerlifting problems for you. So if we are rehabbing an injury, we want to be able to get over that injury as quickly and as efficiently as we can so that we can get back to doing what we want to do and performing at our highest levels as quickly and efficiently and as painlessly as we can. Like, we don't want to be stuck in pain. We don't want to be stuck struggling. We don't want to be stuck rehabbing for longer than we have to. So if we want to get over an injury as quickly as we can, we need to know what not to do and what pitfalls to not fall into, because everything I'm going to talk about in this video are things that people will often do thinking that they're helping themselves, thinking that they're doing a better job and thinking that it's the right way to go. But in doing them, they end up stuck, they end up not making progress, they end up regressing, they end up re-aggravating an old injury and then just continually getting into this loop of, I hurt myself, I try to rehab it, it doesn't work, I hurt myself again, and just going back and forth and back and forth, back and forth with rehab and re-injury and relapse, and they never get anywhere as the worst case, and best case they get somewhere, but it doesn't feel very good, it takes way too long to get there. So what we need to know is, what do we do if we want to stay in pain? If we know what we do to stay in pain, we will know what we need to do to get out of pain as quickly and efficiently as possible. Cooper is freaking out at some birds flying overhead, so I apologize if you hear her in the background, but without further ado, let's get into it. So first thing to do if we want to stay in pain is going to be to just rest and wait for it to go away, because time heals all wounds, right guys? Well, not quite entirely. And it's like, yes, the healing process, healing does take time. Healing will require time, but if we do absolutely nothing and we completely rest a body part in attempt to let it heal, when we go to use that body part again, we won't have done anything to get that body part ready to train. We won't have done anything to get that body part ready to have load put on it. And it's just gonna hurt again because we haven't done anything to prepare it, and we're at a higher risk of re-injury just because during that whole rest period, we're letting things get weak. And I dealt with this way too long with my knee after I was coming back from my quad tendon rupture, just because I was told not to load it, I was told to rest it, I was told to let it heal. And in doing all of that, I never got it ready to train. And then it was like, as soon as I put some weight on the bar, it would hurt super bad. And I instantly thought, okay, I'm doing too much, I just need to let it rest more and rest longer. And that was not the answer, because I never got anywhere. It was as soon as I started using it and doing things with it and building it up, that's when it started to get better. And it's like, during the healing process, when tissues are compromised, yes, it is very important to not exceed their current capacity. But all we have to do to make sure that we do that is listen to our bodies. And if things start to feel really sketchy, that's the sign that we slow down. If things don't feel sketchy, the more we can use it, the stronger it will heal and the stronger it will be when it comes time to get back to training. So that's number one. Number two thing we need to do if we want to stay in pain, if we want to make our rehab process really long and really shitty, is to use only passive treatments. Use only done to you treatments to get out of pain. Don't do anything for ourselves. And this kind of goes right in line with doing nothing and just resting. Because it's like, yes, passive treatments are a step up from complete rest, just because we are doing something to our bodies, we're having something done to us, we're getting massage, we're getting tissue work, we're getting an adjustment, we're getting ultrasound, cold laser, shockwave, blah, 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 all that stuff. It's great because it can help us feel better faster, but it has the exact same pitfall as just complete rest does, because if all we're doing is getting things done to us, it's not presenting a challenge to the body to create an adaptation, to make ourselves stronger, to make ourselves more durable, to make ourselves more resilient. So if all we're relying on is passive treatment, we're not gonna get anywhere. And it's just going to take so much longer to get back to performance, because we're not doing something to challenge our bodies to create the adaptation. And a lot of times people do get away with just using passive treatments for smaller things or for certain things, just because the passive treatment lets them feel better so they're able to use their body, and then using their body is what actually makes things better. But if they've had that happen and passive treatments have worked in the past, that can let them fall into that pit of just not doing enough to drive progress, and that's how they're going to end up getting stuck if they're only relying on passive care. Number three, if we want to make sure that we are staying in pain and that we're stuck in pain, is that we need to make sure that if we are doing active care, if we are being proactive in our recovery, that we're not going to do it often enough to actually create a stimulus. And the thing is that when we are freshly injured, when we're in pain, we are going to be very limited in what we can do just because we're in pain. Like if you've ever had a super, super bad back tweak, you'll know that that back tweak friggin' sucks and there is not a lot you can do with it. Like you can't deadlift, you can't squat, you can barely get out of bed. So the things that we can prescribe, the things that we can do, the things we can get someone in pain doing for their back pain, the movements are going to be so low grade in both loading and range of motion and complexity that the stimulus per rep, the stimulus per movement is going to be extremely, extremely, extremely low compared to what we actually want to be doing with ourselves in training, in competition. So if we want to make our active rehab work when we can't do a whole lot for ourselves, we need to do that stuff extremely often in order to create enough stimulus to drive us forward and to generate progress with our rehab. Next thing, number 4, I think we're at, if we want to make sure that we are stuck in pain and in pain for as long as possible, even if we are doing active care, even if we are doing it often enough to create a stimulus, don't progress it, don't do more as we can do more. And I think one of the best examples I can remember of this is one of my first patients. They had repeated back tweaks deadlifting. And with their repeated back tweaks, they always did the McGill Big 3, they always did the McGill stuff, and it got themselves feeling better and they were able to start deadlifting again. But then as soon as they put some heavy weight on the bar, pop, it would tweak again and they were back to square one and they felt worse and they felt less confident than they had before just because it kept on happening. And when I talked to them, they were like, I have no idea why this is happening. I do my McGill Big 3 every single day. I shouldn't be getting hurt like this. And it's like, well, let's think about what's going on. In McGill Big 3, they are freaking fantastic for desensitizing stuff. They are fantastic for building control and stability through the torso, but the loading just is not there to get us to where we need to be if we want to be able to express force and use our spine underneath the barbell. The problem is that they were not progressing what they were doing, and because they were not progressing what they're doing, progressively challenging themselves as they gained ability, they didn't actually gain any ability. They were just feeling good, and then when they exceeded their threshold on a deadlift, they went back to square one. And it's like, as far as that progression goes, you could go a simple route and just say, potentially scale back slowly on deadlifts, making sure you're not exceeding what you're prepared to do. You'd also go with a more complicated route and then break up movement segments and do things like loading spinal flexion and doing back raises, J curls, that kind of stuff. Loading single leg hip extension with single leg RDLs, loading rotation, loading flexion with direct ab work, direct hip flexor work. And that could be another way to build progress and bridge back to your full training capacity. But either way, just make sure that you are progressing things as you go and as you gain ability. And the last thing that we're going to do, if we want to make sure that our rehab sucks and want to make sure that we stay in pain and we want to make sure that we don't actually get better, even if we are doing active rehab, even if we are doing it often enough, even if we are progressing things as we go, the number one way to make sure that we stay in pain and stay stuck in pain is to be afraid of pain on the way, and is to make sure that we avoid pain at all costs. Because the thing is, in order to get better, we need to challenge ourselves. And if we are dealing with an injury, if we are dealing with some degree of tissue damage, or even if we are only dealing with sensitivity, in order to deal with that sensitivity, in order to deal with that tissue damage, we need to challenge ourselves to create that stimulus to get better. And in challenging ourselves, it might not always feel good. We might feel some pain. The thing is though that yes, we do need to push into pain a little bit, but that doesn't mean that we need to try to make things hurt. That doesn't mean that we need to try to feel bad as we go. We just need to be okay with feeling a little bit of pain, and we need to be okay with challenging ourselves, and we need to be okay with getting sore, because logically, if we have been hurt and we are challenging ourselves, it should not always feel fantastic. We should expect to feel some pain just because we're challenging ourselves to create the stimulus to get ourselves better. The trick there, again, is just going to be to not really piss things off. And a good sign is that if you feel worse the next day, you probably push things a little bit too hard and you just need to back off. If you feel worse the next day, that does not mean stop. That just means back off a little bit on the challenge that you gave yourselves. And if you end up feeling worse, your goal should be to see how fast you can get yourself to feel back to normal or feel at least a little bit better. So guys, we know what to avoid with rehab. We know what not to do, so we can better understand what we should be doing. So if we are in pain, if we are trying to get rid of an injury, if we are trying to feel better as quickly as possible, make sure that we're actually doing active rehab. Make sure that we're doing it often enough to create a stimulus. Make sure that as we can do more, we are actually doing more, and make sure as we're doing that, we're not afraid of pain, but we're not purposely trying to make ourselves hurt. So guys, if you got here, like, comment, share this with your friends, share this with someone who is stuck in pain, with someone who needs to rethink their rehab. And you know what? I forgot one point that I wanted to make, so back that up, not restart, but the biggest, most important thing, that if you're stuck in pain and you believe that you are stuck in pain and you believe that there's nothing that can't be done, you will not be able to do anything for it. Just because if you believe that it can't be done, you're not even going to have a reason to try. You're just going to be there. And with myself in my own career, the biggest thing that I was limited by a belief that I couldn't get better in was with my right shoulder, with the history of multiple surgeries, multiple dislocations, multiple fractures, blah, 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 blah. No one needs to hear that bullshit because it's not interesting anyways, but my shoulder was fucked up, and I believe that because of everything that had happened to it, it was just going to be fucked up and it was only going to get worse, and that I couldn't do anything with it anyways, so I should just accept how it was. And I did that for a lot of years until I kind of realized that like I could do something for it, that wear and tear isn't entirely reflective of the degeneration process, and that by doing nothing, I was allowing it to get worse. And as soon as I started to realize that I could do something with my shoulder, and I started to challenge it, I started to train it, and I started to build up control and build up strength at its end range, and started asking for more range, I began to get more range. I began to be able to feel better. I began to actually use my arm. I was able to bring my grip on a squat bar. I was able to actually squat low bar. I was able to bench close grip again. I was able to do dips. I was able to do overhead presses. I was able to do so much stuff that would have set me back for weeks or months on end, and it ended up starting to feel therapeutic. So guys, flashback, if you're stuck in pain, do not believe that you're stuck there, because if you believe that you're stuck there and if you believe that you can't try, you're not going to try. And if you're there and you can't figure it out, shoot me a message and we can help you get there. So again, thank you for watching. Like, comment, subscribe, share, all that. Don't be afraid of training. Get your rehab together, because powerlifting, it's probably going to hurt, but it doesn't have to hurt all the time, and you should be able to make progress. Thank you for watching.